Greetings, I am Dr. Katrina Strozier. I am an OBGYN, and I am passionate about March of Dimes, specifically because I take care of a lot of high-risk patients. We first need to define what that means. Most of times when you get pregnant, you expect to go all the way to term, so you get to your due date. However, it is considered preterm delivery if you have a baby before 37 weeks. It is considered early term if it's between about 34, 37 weeks, moderate term 32 to 36 weeks, and it's very extreme preterm anything less than 32 weeks. And when we are classifying what that means, it is a huge discrepancy in a baby born at 24 weeks versus a baby born at 35 weeks, how much time they're going to be in the hospital, how many organ systems they might be fighting. When you're in the hospital, just a regular healthy adult, if you get sick with something, you also can get hospital acquired infections. So it can be a really long course for very early babies. So when we're looking at statistics, specifically, we know that about 500,000 women in America will have a preterm birth. And when we're talking about preterm, there are a lot of different reasons why people have babies preterm. They can go into labor early, they can break their water, they can have high-risk medical issues that require them to be delivered early. So, there's a lot. So when you look at those statistics, that means 1 in 10 women will have a preterm delivery in America. Those are alarming rates. We know that with a lot of medical issues, African American women are number one on that list. When we look at statistics of preterm deliveries, African American women are about 14% of preterm births in comparison to Caucasian women that might make up about 8% when we're looking at all births. There are so many things. Right now, we know that healthcare disparities amongst African Americans in general are wide. They're vast. We're looking at access to healthcare. We are also looking at access to appropriate nutrition. Just, your community, what kinds of grocery stores you have available, what about the times? Because maybe there's a high crime area. I have a lot of patients tell me that they don't have good access to working out, that they are concerned about getting to a gym. Right now we're all dealing with corona, and so people are gaining weight. Obesity is a huge confounder when we are talking about high-risk pregnancies. But they're going to have asthma, they're going to have other airway issues, lots of medication. So what we can do to support these families, what we can do to support research for people who look like me and you, there's just not enough. When I look at the statistics, when I look at the medical research that is being done, most of the time, the research that I have to make my decisions off of, it's based on studies of people that are Caucasian females, not even patients that look like us. So we are now starting to see some research coming in, but it is based off of whatever dollars are being donated for specific causes. So I'm grateful that we are learning about fibroids. I'm grateful that we are learning about high blood pressure and diabetes and how it affects different communities different ways, and how for this kind of patient, use this blood pressure medication. For an African American, use this blood pressure medication. What are we doing to help our families? What kind of research goes into supporting preterm delivery, as well as how do we get prevention, the education that goes behind it. But more importantly, in order to know more, it takes more resources. And how do we get those resources? People like you and I, people who care about this cause, have to give money to organizations like the March of Dimes. That is just simple. When you look at what other organizations or other companies are doing specifically for preterm delivery, preterm births, high-risk pregnancies, high-risk families, families who are dealing with babies that are in a whole nother city from them, the March of Dimes is the organization that is putting their resources behind this cause.
Good afternoon. My name is Melonese Close, and I'm here with Rodney Close and my son Jackson Close, and we are members of the Columbus chapter of Jack and Jill, and we're here to talk about how March of Dimes have impacted our family today. March of Dimes is an important organization for me and my family because we represent stillborn. My husband and I, we met at the hospital, and I had to deliver McKenna. And it was a very painful experience. It was one that we didn't know if we would be able to get through, but with the help of spiritual guidance and our bond, we were able to push through that, and with the help of March of Dimes and their support. In addition, we were blessed afterwards with a healthy baby boy, Jackson Close, who's here with us today. However, we've spent time talking to Jackson about the importance of his sister and what she meant to our family, and we commemorate her every year. And it's important for us to talk about McKenna Reese because it impacts our families more than we realize as African American women. It's something that we don't talk about a lot, miscarriages and stillborns. So it's important that the March of Dimes is there for us to provide not only education, but community service and funding to help get the word out about the importance of educating our families.
You just have to be there to listen. It's nothing that I could ever say that I understand because I don't understand. And what really helped my wife and continues to help other women that have had loss. And there was a book that we received from one of a mom that had a loss that thinks my baby's in heaven. I can't remember exactly, but it just tells the story. And she's an angel looking down for fathers. It's something that we can't relate other than supporting our spouses and being there for them, and just have to give them time with the healing process, because you will always remember that day, that moment, and what it felt like as a family. And so you just have to be patient, don't push it, and just let it run its course, and remember the moments and the memories. And
she's looking over us and protecting us. It's important for us as women to embrace it and to heal and talk about it so we can educate others on the importance of this particular thing that impacted our family, which was the stillborn part, and making sure that we get the word out that you can get through it. With the help of spiritual guidance, professional grief counseling and guidance, and your friends and your support group, you can get through it. And I'm proud to be a part of an organization such as Jack and Jill, that we can partner with the March of Dimes to help get the word out and educate them not only about premature babies and stillborn, but also COGA and what we do for the community as well.